Hi, good evening, everyone. In this section, we'll be looking at some MCQ questions that you might likely come across uh, during your study or during exams, especially in community health. The first question says, the reason iodine is added in a salt is dash. A, to prevent diabetics. B, to prevent simple gouters. C, to prevent Addison disease. D, to prevent Cushing syndrome. The correct answer is to prevent simple goiters. Iodine is essential for thyroid hormone production. Its deficiency leads to goiter. The blood supply to the heart is via A, cardiac arteries, B, coronary arteries, C, carotid arteries, D, arteriosus cardiosus. The correct answer is coronary artery. Coronary arteries are arteries that wrap around the heart and provide oxygenated blood to the cardiac muscle. One of the signs and symptoms of wound is A, injection, B, hemorrhage, C, injury to deeper organs, D, damage to the skin. The correct answer is D, damage to the skin. A wound involves a break or damage to the skin or underlying tissues. In auscultation, the apex of the heart is located at what level? A, fifth intercostal space, B, fifth rib, C, third intercostal space, D, fourth rib. The correct answer is A, fifth intercostal space. This is typically where the heartbeat is heard best. It is also known as point of maximal impulse. The human nose performs the following functions except A, smelling, B, respiration, C, filtration of air, D, detection of poisons. The correct answer is D, detection of poisons. While the human nose can detect odors, it cannot detect poisons directly in a clinical sense. Which of the following is not a health hazard associated with improper disposal of human waste? A, increased infant mortality rate. B, breeding of pests and vectors. C, contamination of crops and vegetation. D, odor nuisance. The correct answer is A, increased infant mortality rate. Although improper waste disposal contributes to disease, infant mortality is an outcome, not a direct hazard. MRDT stands for A, Malaria Rapid Diagnostic Test, B, Malaria Rapid Diagnostic Therapy, C, Malaria Rapid Demographic Therapy, D, Malaria Rapid Diagnosis Test. The correct answer is A, Malaria Rapid Diagnostic Test. MRDT is a quick test used at point of care to detect malaria antigens in a blood sample. It's mostly used in primary healthcare level. Cardiac reserve means A, ability of the heart to adjust its outcome to meet the metabolic needs of the body. B, ability of the heart to receive blood to maintain the metabolic needs of the body. C, ability to pump. D, ability to receive blood flow. The correct answer is A, ability of the heart to adjust its output to meet the metabolic needs of the body. Cardiac reserve is the heart's capacity to increase output during stress or exertion. The medulla oblongata helps to regulate which of the following? A, breathing. B, heartbeat. C, sneezing. D, all of the above. The correct answer is all of the above. The medulla oblongata controls vital autonomic functions such as breathing, heartbeats, reflex such as sneezing. The division of the nervous system does not include one of the following. A, central nervous system. B, synaptic nervous system. C, peripheral nervous system. D, autonomous nervous system. The correct answer is B, synaptic nervous system. This is not a recognized division. The correct divisions are the central, peripheral, and autonomic, not autonomous nervous system. The process by which the bone matrix is formed and hard mineral crystals composed of calcium and phosphorus are bound to collagen fibers is termed A, osteoporosis. B, ossification. C, mineralization. D, osteopenia. The correct answer is C, mineralization. Mineralization is the deposition of calcium and phosphorus crystals into the collagen matrix of the bone, making the bone hard and strong. Which of the following is involved in immune system and response? A, melanocytes. B, T helper cells. C, hairs. D, sweat. The correct answer is B, T helper cells. These are types of white blood cells that play a central role in immune response. The father of occupational health is known as A, Auguste Comte. B, Bernardino Ramatos. C, Aristo. D, Adam Smith. The correct answer is B, Bernardino Ramatos. Often called the father of occupational medicine, studied the health risk associated with various occupations in the 17th century. The chemical name for paracetamol is A, metronidazole. B, acetylsalicylic acid. C, acetaminophen. D, ascorbic acid. The correct answer is C, acetaminophen. Acetaminophen is a chemical and also international non-proprietary name for paracetamol. The human nose performs the following functions except A, smelling. B, respiration. C, filtration of air. D, detection of poison. The correct answer is detection of poisons. The three main activities that are related to long-term memory include all but one. A, storage. B, deletion. C, retrieval. D, permanence. The correct answer is B, deletion. Long-term memory involves storage, retrieval, and retention, also known as permanence. Deletion is not a typical feature of long-term memory function. If a patient's respiratory rate is 10 breaths per minute, it is called A, normal breath, B, bradypnea, C, bradycardia, D, tachypnea. The correct answer is B, bradypnea. Bradypnea is abnormally slow breathing. Normal adult respiratory rate ranges from 12 to 20 breaths per minute. Thank you for joining this section. I hope you find this useful. Check the next section to continue.